Hi, this is Amanda Dolan, and welcome to the Mental Society. Today, we are joined by Dr. Melissa Green. Dr. Green is a clinical psychologist who has worked in the mental health field for over 20 years. She's earned a master's degree and an advanced certificate in school psychology from Howard University, and she earned her doctorate in clinical psychology from George Washington University in Washington, D.C. In 1998, Dr. Green started her mental health career as a school psychologist in the District of Columbia, and she continued that work in Virginia, Georgia, Hawaii, and the U.S. Virgin Islands. In 2009, she pivoted her career working on a military installation in Hawaii for 5 years. While she was there, she co-facilitated a group with a yoga teacher, and that inspired her to complete a yoga teacher training program after she saw the benefits that her military clients received from their yoga practice. In 2017, Dr. Green's career shifted yet again into forensic psychology. She spent 3 years working as a forensic evaluator in a psychiatric hospital, performing competency to stand trial evaluations, violence risk assessments, and testifying as an expert witness. Dr. Green currently focuses on teaching brain health, healthy aging, and supporting dementia family caregivers. Oh my, that is so much in a career in just 20 years. That's really amazing. Thank you so much, Dr. Green, for being here with me.
Thank you for inviting me.
And when I reached out to you originally, I wanted to talk to you really about brain health in general and dementia and how it relates. And I know that when you and I were talking briefly to begin with, you made this shift into dementia and brain health for very personal reasons.
That's correct. So back in 2014, I was living in Hawaii, living my best life, so to speak. And I just started to notice that my dad was not remembering a lot of things. So every time we go to the doctor, I'd say, hey, make sure you tell them to check your memory. And of course, that's not something to say to somebody that's having memory problems because they will forget. But eventually he remembered after a couple of visits. And the next time I came home, I met with his physician and he did a workup, neuropsychological evaluation. He sent him to a neurologist and he was eventually diagnosed with vascular dementia and Alzheimer's. So 2 types of neurocognitive disorders. And that changed the whole trajectory of my life and the family. So I, within the next year, relocated back to my home state of Georgia so that I could be closer to my dad and help with his caregiving.
And what a gift to him that you are there to support him. And also it makes me think of what sometimes I guess could be burden is not the word that I want to use, but it takes up a lot of the caregiver's time and energy. And for you moved literally thousands of miles to be there to care for him. So how can families support their loved ones as they are navigating any kind of dementia or decline in their overall brain health?
So it's a huge challenge for family members and for the person who is experiencing the cognitive decline. And oftentimes, well, the first thing I think families need to do is to get a thorough assessment. My dad's physician, actually, his dad had been diagnosed with dementia a few years prior, but he had passed on. So it was very personal for him. And I think he really went above and beyond with educating me and my brother, who have power of attorney of my dad, about the things that we could do to support him. So I think the first thing is really getting thorough assessments, whether it's through doing a primary care doctor who specializes in geriatrics, neuropsychologists, neurologists, to better understand the type of uh, issue or issues that are going on, because the treatment plan could look a little different, because there are different types of dementia, because dementia is not a diagnosis, it's just an umbrella term. So there are different types. So it getting more information can help to drive the treatment plan. And also, I think the family has to make a lot of huge decisions, whether or not you're going to bring support into the home versus having the person go out of the home. But what I can say from my personal experience and from my experience in trying to develop things to support dementia family caregivers is that um, they need a lot of support in getting to the point of accepting that this person that they love is actually not functioning at the same level. I can say with my dad, people I think thought that he was functioning higher than he really was, because he had a routine that he was going through
Right.
for years, right? So he looked like he was functioning higher. So they were really kind of minimizing the things that were going on when there were some issues, like, oh, he's just doing that. Yeah. So that's a big thing. Finding ways to get usually there's one or two people in the family that might get it, and they have to be the liaison or be the ones who communicate to the rest of the family.
So then how does that affect the caregiver's mental health and well-being if they are the ones trying to explain what's going on to the others in the family and caregiving and talking to the doctors? How does that affect the caregiver long term?
You mean if the caregiver has to be the one to?
Yeah, like the caregiver, like how it can be a lot, right, to keep someone at
Right.
home dealing with dementia. So what are ways that all of that caring for somebody with dementia, how does that impact someone's mental wellness?
Yeah. Well, it really depends on how it's handled. I think if everybody is, well, for the ideal situation is that the person who has the dementia, they have actually stated what their desire is if they were to get in that stage, so that people don't have to actually guess, right, what to do. But obviously that doesn't happen most of the time. And so, yeah, I think if the family members don't agree, that could have a significant impact on their loved ones. And I'll just say loved one, referring to the person with dementia. If their loved one is sort of caught in the middle, because there may be people that think that they need a higher level of care or more support, meaning people coming into the home, then there may be other people who do not want outsiders, so to speak, in the home, and they may want to be the ones who care for that person. And people have good intentions when they want to do that, but many times people don't, I don't think they see beyond the moment to
Right.
look at the magnitude of what's going on and what all is needed in order to make sure that that person is safe, for one, because I can say from my personal experience, I never thought that I would have my dad go to an assisted living facility. And you and I talked a little bit earlier about cultural factors that may
Mhm.
influence those kinds of decisions. And in the African American community, people rarely ever place their loved ones outside of the home for care. And so that was never a thought in my mind. And I would guess my brother's mind either. And I have a lot of siblings, but my brother and I were the
The
ones who,
primary.
maternity, right? But the reality of the situation, even with me being a psychologist and understanding, I did a lot of psychological testing and understanding
Mhm.
where he was functioning after seeing the psych test data, knowing, some of the things that we could do to support. It wasn't realistic to expect that I could take that on by myself,
Right.
or as a family that we could do it and him get uh, the most benefit from the support, because it wouldn't be our primary
Right.
job. We have jobs that we go to and then come
And
in and
families and.
right. And that's the thing. I think a lot of caregivers, some of them may feel guilty about that. And yeah, that's one of the reasons why I wanted to shift my work to support caregivers in making decisions. Not that I think there's one way, that people should
Right.
absolutely go, but I would like to help people to make decisions that they feel good about, and help them understand that, they don't have to feel guilty if they have to get additional support, because it's probably going to lead to better quality of life. My dad's doctor always said, um, he really needs to, he lived at home by himself. My mom passed away in 2002. So he had been living alone for
Right.
years. And so my dad's doctor always said he needs that socialization. He needs to
Mm.
be around other people. And I tried to take him to, like, I guess it was uh, not adult day health, but it was a community center for older
Okay.
adults. And he may have been 80 or he's in his late 70s, and we went there and he said, "This is for super seniors." And I'm like, "What do you think you are?" So he wasn't ready for that. So we took him there, once, just so he could see if he
Mhm.
wanted to participate in activities, and he didn't. And so we didn't push it. But after his doctor started encouraging us, I realized now that with him going into the assisted living facility, that he has gained so much from that interaction, and he's not even a social person. And so and now there's a lot of research to support that socialization is key in helping us uh to continue to develop new neural connections and all of that.
Right. And I shared with you as well. My mother just well, she's moving in, I think either today or tomorrow. She's moving into a independent living retirement community. She's has been on her own since my dad died in 99, so decades. Um, but she doesn't get out much. She's very introverted and likes, to be by herself. Um, but when she went to check this place out, she ate dinner a couple nights there to just get a feel for it. And it was amazing how different her mood was when she was telling me about meeting new people, and interacting with them. And so while, she doesn't have any sort of diagnosis of any sort of dementia or cognitive decline, although we're saying so much, I want to ask you about in a minute. I think it's been really good for her. And especially when I think about my grandmother, her mom, who lived to be 106 weeks old. She always said she wanted to be 100, and then she was going to be done, and she sure did that. But this was a woman who, up until the last few months, she played bridge at the country club with her friends, constantly interacting with people on the phone, writing letters, very social. And I'm wondering, how much that using her brain, both in relationships with people, but also the almost science or whatever of playing cards, which, like, do those sorts of things, like keeping your brain active, impact how um, dementia or that cognitive decline is experienced?
Absolutely. And the Global Council on Brain Health, which is an organization that's was created by AARP, and I think they work alongside an international organization that does similar things in the UK. They have published research that actually supports this. And one of the things that they talk about to help to combat cognitive decline is doing cognitively stimulating activities. So playing bridge is something that would require you to be able to problem solve and come
Right.
up with tactical strategies on how to go from this point to that point. And also that socialization piece is a part of that
Mhm.
research that is done by the Global Council on Brain Health that says that interaction with other people and it forces you to have to communicate, which that's one way that we're
Right.
combating cognitive decline. Because if you're just sitting at home by yourself watching TV all the time, you're not using that. You're not communicating. You're not having a problem skill. You're not having to navigate through situations and make decisions. All
Right.
those things that we take for granted are involved in that playing bridge and doing it in a group
Mhm.
setting. So I think that's great.
And so one of the things that, I said I was going to get back to it. My mom, we've had her doctors do some tests on her cognitive function, and for the most part, they've been good, except for she's got some issues with her lungs. She has some lung disease that can cause her oxygen levels to drop pretty dramatically in certain situations. And what I and my sister both noticed, which is why we talked to the doctor about her cognitive function, was there were times where she was getting really confused and her words weren't making sense. And now we can see that it was more about her oxygen than her cognition. However, I have concerns that, that repeatedly happening might impact her overall brain health. But how often do things like that happen where there's some other issue, whether maybe it's a medication that the person's taking or some other health thing going on that might show up as if there's dementia or cognitive decline, but it's not? And how do doctors differentiate that?
So I don't have the stats on how often, but I do know that it happens, even with conditions like urinary tract disorders, which I had no idea until it happened to my dad. And I've studied, a lot of
Right.
cognitive disorders when I was doing a lot of testing for school age children. That was kind of my area of specialty. I had no idea that there was a correlation between a urinary tract infection and cognitive functioning. But just like you saw with your mom, I've heard this particularly with older adults that there's some impact on the way that the person is able to think and just really understand what's going on, and it clears up when the condition clears up. So it does happen. I don't know how frequent it happens, but I know that after we experienced it personally and I just started mentioning it to other people, uh, it wasn't something that people had not heard of. And there are other conditions that I've heard that may have a similar type of reaction.
That is the fact that like your urinary tract affects your brain. One, it's fascinating, but also it's another reminder of how important your brain health is and your body, like your physical health. Like you can't separate the two. Like you either take
Right.
care of your whole self or you're not great in any part of your existence, right? Because a urinary tract infection can cause cognitive decline, but also, right, I know for me, people out there may laugh. I have ADHD, and which that means sometimes I don't realize I have to go to the bathroom like until like I'm about to like wet myself. Not because I am clueless, or it's just the way that my brain and body work. And so urinary tract infections are something that I have to be cognizant of. But I never thought like, oh, me not going to the bathroom, like that could affect my brain, but also my brain is impacting, right? Like it's kind of the cycle of all of those things are connected. So like, when we think about how all of those things are connected and to, like that relationships are important, community is important, what are things that like we can do in our community to help all of us long term with our brain health and cognitive function?
So one thing that I think is um, important is for us to start changing our beliefs about aging. Yeah, I read a very interesting book last year. I think it's called Breaking the Age Code or something like that, where uh, the person who wrote it was a psychologist and a professor, and I can't remember where, but yeah, she talked about doing research on the relationship between the whether a person thinks that aging is a positive thing versus a negative thing, and how that impacted their physical aging. So there's definitely a mind-body connection, like you were saying. So I think starting to challenge any negative age beliefs that we have. And sometimes we have them and we don't even realize it because we are bombarded with so many messages in the community about aging or trying to find anti-aging,
Right.
things that are going on. And, I always say I'm 51 and I'm proud of it. And now I learned that there is a benefit to being proud of it. So what they recommend in that book, and I'm going to steal it, is to create an age belief journal and do it over the span of a couple of weeks. Just start to notice and track if, if you say, oh, my birthday is coming up. Oh my gosh, I'm getting old. Those kinds of things that you may say, or your friends may say, or people around you. And then think about how maybe you could reword that and make it more positive, right? And as we get older, we start to attribute things to aging that maybe we didn't attribute to aging before. And it could be because of us getting older, but it
Right.
could not be. But it's an automatic, like after you reach a certain age, that you start to shift all the negatives to the fact that you're aging, and maybe
Right.
not to the fact that you're not sleeping, or that you're, I don't know, overindulging in alcohol or something like
Right.
that.
Which is, you said that, and last night I was at a friend's house and I was walking down the stairs and my knee was clicking and I was like, oh my gosh, I'm getting so old, my knee like is making noise going down the stairs. And I didn't even think about like that was like me saying aging, I guess, could be problematic or is not great because my body's falling apart because I'm getting older.
Right.
Which is
And not right. And not that we want to be delusional. I didn't mean to,
right.
sorry to cut you off, but we want to be realistic about it. But there's a slant towards negative, particularly in our American culture, because we value youth and all of that. And so I think when we're talking to people, we can just start to gently challenge those things. Well, maybe it's because of that, or maybe it's because of this. And also you mentioned walking up the steps or down the steps or something. Just moving more, encouraging each other to, you don't have to run a marathon, but just moving more frequently has also been shown to be so beneficial for brain health and for physical health, obviously, as well.
You got me thinking too that this elementary school that my kids went to and that I spent a lot of time volunteering at, when they had grandparents day, there were some people from some older people, retired people from a local church that came over to be like the grandparents for a day for the kids who didn't have a grandparent show up. And I remember watching those interactions with those people who were older, 60s, 70s, 80s, interacting with these 5, 6, 7-year-olds, and how just the relationship that they created. And it almost seemed like the people that were older, I don't know, there was some like joy that you could see on their face, right? Just like having fun, coloring, laughing. And then these young children had another adult around them that was supportive and showing up. So it's making me think, like, what kind of benefit is there in bringing those two hugely different generations together? I don't know. I don't know that there's really a question in there. I'm just thinking, like, I feel like there's something there.
There is in the positive psychology research, they talk about the benefit of multi-generational relationships as well, and helping people to, to be happy or to feel like they're, having more meaningful or fulfilling lives, because, and especially for the older person, because once people retire, a lot of times they don't feel like they have so much of their identity wrapped in their
Right.
careers, they don't feel like they have a purpose. So participating in those activities with younger people where they can see how they are contributing to their lives can be beneficial.
So, like, in this conversation, I feel like there's a whole lot of being in communion or community with people that impacts your brain health, your cognitive function, and just overall mental wellness. So it sounds like that might be just the first place for all of us to start, is to build relationships that are positive and healthy with people that are important to us.
Yeah, yeah, and it sounds so simple, but I have challenged myself. The more I get into the research, the more I see, relationship. And I always call myself an ultra introvert. I like to be by myself a lot, or just do things by myself, or with my, whoever, if I'm in a relationship with someone, do it with them. But I'm trying to challenge myself to, I want to take a, dancing class and art class, and just more things where I will have to interact with people. And usually once I get there, I'm fine, but sometimes I'm kind of like, I don't feel like, being around a whole lot of people, but it is important. I've seen it over and over and over again. And I frankly saw it with my dad. I don't believe he's 90. I do not believe that he would still be here had he not been in that facility where he is constantly interacting with people who are, communicating with him, and forcing him to have to communicate as well.
But you brought something up about wanting to take an art class or dance class. Creativity. How does being like creative in those ways, writing, art, dancing, how does that impact our brain?
Well, I think anytime you're learning a new skill, you're stretching that muscle, so to
Mhm.
speak, in the brain. You're creating new neural connections, and that is a protective factor against cognitive decline. Because for a while, people thought that, as you get older, you really maybe can't learn as well, which is not necessarily true. I mean, there are some, we may have some memory moments
Right.
where we forgetful, but dementia is not a normal part of aging. So you are still able to learn. You're just as capable, unless you've had a head injury or something significant happen to impact that.
So now I'm going to ask how does a traumatic brain injury affect dementia?
And it really
Yeah, that's
depends.
still the research is in process, maybe.
Well,
Because,
and it depends. I know if you look at, there's more and more research coming out about athletes. Actually,
Mhm.
last week I attended a conference on called Black Men's Brain Health, and they were actually holding it wherever the Super Bowl was held in Arizona, I think. Yeah, because they were just looking at like the trend of these head injuries resulting in people having cognitive decline or even some types of dementia. So it depends on, I guess, the severity of the head injury. I worked for a while with active duty service members, and part of my responsibility when I worked on military installation was to do cognitive assessment before they deployed and then post deployment as well. And we would look at any differences in scores, but we would do it to get baseline data on their cognitive functioning. But it really varies from person to person
Mhm.
depending on a lot of factors. There's so many factors that come into play as to whether or not um, this head injury will have a significant impact.
And then, like, head injury is a physical, injury, and that affects the way that the brain functions. And mental illness is also, how the brain is not functioning optimally, I guess is maybe a way to put it. So is there any link that you know of or you've seen in your own experience between someone with a mental illness, throughout their life and their overall cognitive health?
Well, personally, I haven't seen it, but I know that, again, referring back to the Global Council on Brain Health and their recommendations, they talk about uh, learning ways to manage stress to minimize the possibility of cognitive decline, because if you're not able to manage stress, then obviously you're for those people who are experiencing stress or traumatic stress particularly, then they're constantly being flooded with uh, stress hormones,
Right.
and that's not good for our bodies, our nervous system, right? So learning how to manage stress can help us to minimize the impact of those stress hormones and not have them constantly flowing through our bodies. We need them for that short period of time when we feel like that we may uh, be
Like when
coming in
there's a bear
contact.
chasing, right? Like
Exactly.
bear, we need
But
to.
our nervous system is fascinating, but it hasn't evolved to the point where it distinguishes between us being chased by a bear or somebody just getting on your nerves at work, right?
Right.
So learning how to manage your reaction to it can help to decrease the how much you're exposed to those hormones that are helpful in short periods, but over the long periods when you have chronic stress can start to affect you physically.
Yeah, and it's, when I work with people, I remind them that, like, fear, like that anxious fear and excitement feel very similar in our body. Um, and so sometimes it's how you interpret something as well that affects the release of those hormones, or, how you're experiencing life. And I kind of think of, like, those stress hormones, like, what is it? Cortisol, is that the one
Mhm.
it can cause inflammation as well in our body. And so, um, and I wonder, and there may not be an answer to this, but inflammation and all of that as well, like when you're not caring for your physical body too, how all of that is impacting how your brain is aging. Um,
Right.
and
Right.
yeah, so this is all interesting that it really is about starting now. Like, don't wait, right, to take care of yourself and your brain, and maybe even don't wait to have those discussions with your loved ones about what the future might look like if these sorts of things happen. And with your siblings too, like, are we gonna put dad or mom in a facility? If so, who's making those decisions? How are we gonna have that conversation? Consider the costs and the, how you feel about it too. Because I know for me, in my experience, my ex-husband's grandmother is at a place where she probably needs to be in some sort of assisted living, like the very, like, just barely assisted, but it's been really a struggle because she doesn't want to go, and being a Hispanic family, there's this, we've got to take care of her here. And so sometimes I'm just, if they had those conversations earlier, I wonder what would have looked different, like, how that would have been different. But yeah, this is all interesting, and how it all plays together, and how we really do have some control over how our brains continue to grow and age and change. And you sent me a link that I'm going to share in the show notes, that is something that you have, that's the top 6 secrets for brain health and healthy aging.
Yes.
So I'm going to share that in the show notes, as well as I'm going to find the book that you mentioned. You said Breaking the Age Code. I'm going to figure out.
I think her name is Becca Levy.
I will.
Yes, Becca, and it's Levy.
All right. Well, I will find that and put that in the show notes, as well as a link to the Global Council on Brain Health, so that you can find more information there. I know, Dr. Green, you mentioned that organization and their website several times, so you can go there and find information. I'm also going to link Dr. Green's website below, so you can find more about what she does. And if, she probably has some additional resources that would be useful for you. And you are licensed to practice in Hawaii and Georgia currently, is that correct? So if you are in Hawaii or Georgia and you are looking for someone to help you on that path of figuring out how to help your loved one and yourself go through that journey, as a loved one moves through dementia and into additional care, or how you can continue to support the loved one, I will make sure that you can reach out to her, and I'm sure she'd be more than happy to work with any of you that are in those states. It's key because licensure is not always across state lines. So, but she might also, actually, I'm guessing that Global Council on Brain Health would also have some resources that are local to you as well.
Probably so. I know. Are you talking about local mental health
right? Yes.
Resources? I would recommend maybe Psychology Today.
Okay.
If you.
Yeah. And I have a bunch of resources on the website too. But I know that geriatric psychiatry, psychology, and medical care is something that's growing as the baby boomer population ages. So I'm sure there are plenty of people out there that can help you. And I'm sure that there are even support groups and other things like that if you need them, and are looking for those. So as we discussed earlier,
the Alzheimer's Association. Oh, I'm sorry. I was just going to say Alzheimer's Association. They do have a search database where you can find local support groups and clinicians, I believe, as well.
Okay, I will find that too and link that below. And we also, we already talked about how community and relationships really do help your brain continue to stay healthy and functioning at a higher level for longer. So having those additional support groups are not just good for you to have support, but also good, right, in creating relationships and continuing with those community kind of things. So Dr. Green, thank you so much for joining me today. I really enjoyed this conversation and learning more with you.
Thank you for inviting me. It was my pleasure.
And so with that, we have reached the end of today's episode. Thank you for listening and learning more about mental health and society. Now go out, open a conversation, and discover how mental health is experienced in your world. You can find more episodes of the Mental Society in all the places you find your favorite podcast. Please make sure you subscribe so you don't miss out on anything. You can find other resources and articles by visiting our website, which is thementalsociety.com. And remember that you are not alone in your struggles. Hope and help are all around you. And until next time, this is Amanda Dolan, wishing you good health, mental and otherwise.